Good evening, everyone. Good evening
Hello.
and welcome to our CBME Group 9 webinar. Can I have the next slide, Sunanda?
Yes, ma'am. Just a minute. It's
So
not
just
moving.
otherwise just click on the screen and
Yeah,
then
yeah.
say next. Huh? Yeah, it'll move now. Try.
Huh. Yes, ma'am.
Yes. I would like to talk about team building and group dynamics before I start. And no, the earlier slide. Earlier slide. Yeah, and
Is
then
it
the
okay, ma'am?
next.
Yeah.
Okay, yeah, next, yes, next. You know what happened with our group? We were ninth, so naturally we thought we had a lot of time. But we started about a month or more ago, and we started forming the group. Once we formed um, the group was a little disjointed. And there were some people who had some ideas, others who had some other ideas, and finally there was a big storm that happened. And with the storm came a lot of brickbats here, there, everywhere, and we were sort of going through a real bad storm. But after the storm there was a lull, but during the storm also some work was getting done, mind you. But at that time, the morale of all my teammates was at an all-time low, because we really didn't know how to go about it and how to, whether we would ever move out of this whole jungle that was there. But fortunately, things started uh, calming down, and we started accepting each one in our team as or the way they are. And we finally had the semblance of a webinar and of a whole a sort of a plan ready. And that's when we sort of normed into a situation, and the morale of the team members increased. And this time, today is the time when we are going to perform in front of you and let you know about how we finally made it. We hope you enjoy our show. Next, please. So we are all ladies in the group. Sayed and Vishal Babu, somehow we just lost them. We just could not have any contact with them. And we have one Krishna Kanhaiya amongst us, Vineet Khemka, who also got busy with a lab that he's setting up, and he's in Delhi and he's not in his hometown, and that's the reason why he helped us a bit. And then we sort of put it all together, and someone else is going to be reading his ECE slides for us. So with that small brief introduction, over to Sunanda.
Yeah. Good evening, everybody. Thank you, Bedi sir, for forming the group and letting us to learn so many things. And thank you all the facilitators who are helping out to make this presentation throughout all the groups. The objectives of this presentation are in two parts. The first part related to the topics cancer genetics, where we framed the SLOs, TLM, that is teaching learning methods for competencies BI 10.1 and 10.2, ECE on tumor markers. Coming to the second part, the topic of the second part is immunity, SLOs and teaching learning methods for competencies BI 10.3 and 10.4 and 10.5. We have even made one CBL on multiple myeloma. There was we also constructed one integrated teaching session, ECE on vaccine development, SDL and tutorial and integrated assessment, and finally the summary of the today's presentation. So let us go to the first part, the first topic, cancer genetics. The competencies related to cancer genetics are BI 10.1 and 10.2. This is prepared and presented by me, Dr. V. Sunanda, Professor Head of Biochemistry from Mamata Academy of Medical Sciences, Hyderabad. Competency 10.1 and 10.2 states like this. BI 10.1, describe the cancer initiation, promotion, oncogenes, and oncogene activation. Also focus on P53 and apoptosis. BI 10.2 states that describe various biochemical tumor markers and the biochemical basis for cancer therapy. SLOs for these two competencies goes like this. By the end of this session, that is the teaching learning session, phase 1 MBBS students should be able to explain different phases of cell cycle and its regulation, describe the role of tumor suppressor genes and P53 in cell cycle regulation, define cancer, promotion, proto-oncogenes, oncogenes, and tumor suppressor genes. We are here just defining the respective terms. We are not going into the depth of those terms. The next SLO states that differentiate between the features of normal and cancerous cell, describe the process of cancer initiation and promotion, enlist different proto-oncogenes or oncogenes with associated cancers, explain the mechanism of activation of proto-oncogenes to oncogenes with suitable examples, describe the role of tumor suppressor genes in carcinogenesis, define apoptosis and enlist the apoptosis mediating genes, special focus on P53 and its role in apoptosis. Coming to the SLOs related to 10.2, define tumor markers and enlist various tumor markers with its clinical importance. Enlist any 4 anti-cancer drugs and discuss the biochemical basis of cancer therapy. Explain the rationale behind the use of anti-cancer drugs. Describe the role of monoclonal antibody in cancer treatment. So these are all the SLOs related to that is BI 10.1 and 10.2. Teaching learning methods and assessments would be, firstly, the teaching learning methods. It would be a didactic or interactive lecture, and we even plan for a we can plan for an integrated teaching session with either the many departments like pathology or general medicine or OPG or general surgery, even urology people. We can make one interactive session and integrated teaching, and we can frame one ACE module. We can even frame one SDL module for this topics of 10.1 and 10.2. Coming to assessment, we can give short essay questions, multiple choice questions, and Viva OC. We have a plenty of chance in asking so many questions related to tumor markers and even the cancer genetics in Viva OC to the student. Coming to the duration of the session, we have planned for 3 hours. Now I request Dr. Swati to present ECE module.
Good evening, everyone. Myself, Dr. Swati. So first of all, I would like to thank the organizers and Dr. Sujata Tandekar ma'am for her constant guidance for junior staff like us and the other team members. So my topic is ECE module on tumor markers. The competency for this session is BI 10.2. It states that describe various biochemical tumor markers and the biochemical basis of cancer therapy. Ma'am, next slide. The specific learning objectives for this given session are, at the end of the ECE module, the first MBBS student shall be able to define the tumor markers and list the various tumor markers, justify the properties of an ideal tumor marker, explain the clinical applications of tumor markers, elucidate the role of clinically important tumor markers in at least 3 diseases, identify the precautions to use tumor markers in the diagnosis of cancer, and reflect on the communication and empathy in a doctor-patient encounter of counseling cancer patients and motivating them for regular follow-up. Ma'am, next slide, please. So the plan of the ECE session is in a classroom setting through a paper case. So the case allotted to the students is a 60-year-old retired engineer initially complained of frequency of micturition, urinary urgency, and hesitancy associated with a weak stream. Over the past several weeks, he has reported a few episodes of hematuria and incontinence. Physical examination of the patient was done and it is normal. His past medical history was unremarkable. A digital rectal examination was done and it revealed that the patient has an enlarged prostate gland with several palpable discrete nodules. And laboratory investigations were done. The CBP was found to be normal. The renal function tests were within normal range. and all the liver function tests were within normal range. The serum total prostate specific antigen was found to be 95 nanograms per ml. Prostatic biopsy was done and he was diagnosed as a case of prostate adenocarcinoma. So this case history is given to the students and followed by a few images and videos to explain well. So the images is the first basic image of the anatomy of the prostate, the normal prostate surrounding the urethra, and now the prostate cancer tissue, that is the enlarged prostate cancer tissue which is compressing the urethra. Then the second image, that is the digital rectal examination for the examination of the prostate, which is the gold standard for the diagnosis of the prostate. So this the patient can just reflect when he goes for the surgical postings. And then a small image on the ultrasound guided biopsy of the prostate done transrectally. Followed by a pre-recorded video will be shown where physician communicates with the patient and counsels the patient will be shown to the patient. So with the case and the videos, the questions and discussion. So the questions are divided into two domains, that is to cover the cognitive domain and to cover the affective domain. So the facilitated guide questions for the discussion are: how do you justify the diagnosis of prostate cancer in this case? What are the other tumor markers elevated in this condition? What information do you seek from the other laboratory investigations? And can you add some other laboratory investigations to be done in this patient? Next, justify the ideal properties of a tumor markers and justify whether PSA is an ideal tumor marker. What are the clinical symptoms of prostate cancer and explain them. Brief about the treatment and follow-up of this case. Then the other domain which covers the affective part, that is the observer guide. The students will be instructed to observe the video which was shown earlier and answer the given questions. Observe the patient's emotions and listen to his narrative as he speaks with the doctor. Observe the interaction between physician and the patient and family members and emphasize how physician responds with humility and optimism. Observe the physician explaining the importance of screening in potential cancers like prostate cancer. Observe the physician counsel the patient and family members about the various modalities of treatment and the need for regular follow-up with consent. Ma'am, next slide. So the total time allotted for the ECE module is 3 hours. In the first 20 minutes, the introduction about the module, and the students are divided into 6 groups. Each group constitutes 20 members. So we have 120 students in our session, and the instructions will be given to the students that they need to select a representative from each of the group who will be answering the session allotted to them. And 80 minutes will be allotted for the case and the videos and the questions and the discussion session. And the 30 minutes for the summary of the ECE module. So this is done by the lecture and few video clips, and the reflection 20 minutes, and finally assignment is allotted 30 minutes. So the assignment can be done by various modalities. I have chosen like one way is by asking them to write down or mail the observations of the video which was shown to them on physician-patient interaction, or by a small role play where the students can choose themselves randomly and to show the importance of the outcome and the role of the physician as a communicator and counselor for patient compliance in treatment and follow-up. So the role play can be done by asking the student groups to be a patient and a doctor, and what are the questions they need to talk to the patient and the family and what points to be observed. The summary and conclusion will be given at the end 30 minutes. So an interactive lecture will be done on various tumor markers, summarizing the entire tumor markers, and a small video on the tumor markers, and a small video on the prostate cancers and the metastasis of the prostate cancers. Then another 10 minutes I have taken for explaining the various cancer support groups and the need for motivation in such patients for regular follow-up. So this I will be explaining to the students, followed by a 2 minutes video. The role of the cancer support groups in such chronic non-communicable diseases like prostate cancer. And the 10 minutes will be for the feedback from the students, what issues they liked and what needs to be modified from the faculty side. So the final goal of this ECE session is to emphasize the role of the Indian medical graduate as per the GMR 2018 rules. So the student at the end of the final year will definitely be a good clinician by applying the cognitive domain. But he needs to be a good communicator, and finally he needs to be a lifelong learner. So he can motivate few of the patients to enroll in a clinical trial, whereby a new clinical modality can be framed out. And he can take up a good leadership by forming a cancer support group. And finally, a good professional by incorporating both the cognitive and affective domains. So at the end of the ECE suggestion, I would also like to suggest the students to take up this as an elective session when they go for third MBBS phase 1. So during the 2 months period, they can go to a screening center. They can take up the data, how many patients were screened for PSA, and out of that, how many are symptomatic and how many are asymptomatic. In that way, one elective can be taken. In the other elective, they can visit a cancer support group and they can just write down the points, how much they were motivated and how much it was beneficial by such group. So thank you for the organizers once again. Thank you.
Over to Vaideki. Yes, I request Dr. Vaideki to present. Hello, Dr. Vaideki. Suchita ma'am, I think there is a discrepancy. Hello?
Dr. Vaideki, can you unmute yourself?
Yes, Dr. Vaideki, please unmute yourself.
Sorry. Good evening, everyone.
Yeah, great.
I'm Dr. Vaideki. I want to thank Suchita ma'am and our team members for their support and guidance. I'm going to present the specific learning objectives for competencies BA 10.3, 10.4 and 10.5. Ma'am, next slide. Competency 10.3 prepared by myself and Dr. Vandana ma'am, and BA 10.3 describe the cellular and humoral components of the immune system and describe the types and structure of antibodies. Specific learning objectives at the end of teaching learning session, MBBS phase 1 student must be able to name the primary and secondary lymphoid organs, enumerate the types of immunoglobulins, illustrate the structure and functions of various types of immunoglobulins, discuss the function of various structural elements in the immunoglobulin, describe the components of cellular and humoral immunity with its mechanism. Next slide, ma'am. Discuss about antibody class switching in immune response. Describe the role of antibody diversity in immune system. Define the principle of hybridoma cell formation. Enumerate the uses of monoclonal antibodies. Distinguish between primary and secondary immune responses. Enumerate the causes for hyper and hypergammaglobulinemia. Next slide, ma'am. Competency 10.4 prepared by Dr. Vidya Patil and Dr. Vijita Senai. And BA 10.4 describe and discuss innate and adaptive immune responses, self and non-self recognition, and the central role of T helper cells in immune responses. At the end of teaching learning session, MBBS phase 1 student must be able to classify immune responses and give examples for each type, discuss the mechanism of innate immunity, discuss the mechanism of adaptive immunity, describe the central role of T helper cells in immune responses, describe the mechanism of self and non-self recognition. Next slide, ma'am. State the immunological basis of graft versus host rejection. Elucidate the role of major histocompatibility antigens in self-recognition and graft versus host rejection. Describe the concepts of immune tolerance and autoimmunity. Discuss the basis of immunotherapy. Distinguish between types of hypersensitivity reactions. List the cytokines with their source, target, and functions which control the immune responses. Describe the biochemical basis of immunodeficiency states like severe combined immunodeficiency syndrome and HIV acquired immunodeficiency syndrome. Competency 10.5 prepared by Dr. Vijay Chamundeshwari and Dr. Vineet Kimka. BA 10.5 describe antigens and concepts involved in vaccine development. Specific learning objectives. At the end of teaching learning session, MBBS phase 1 student must be able to define antigens with types of antigen on the basis of immune response, includes a complete antigen, hapten, and determinants of antigenicity. Describe the types of antigens based on their origin, includes exogenous, endogenous, and autoantigens. Differentiate between the immunogenicity and antigenicity. Explain the mechanism of immunity through vaccination. Discuss briefly the steps of vaccine development. Enumerate common vaccines under National Immunization Program. Discuss the future of prospective of COVID vaccine under trial. And teaching learning method can be done in the form of lectures, flipped classrooms, or tutorials, SDL or ECE. And assessments can be done in the form of MCQs, short answer questions, and Viva OC. And now I hand over to Dr. Vidya Patil for further discussion. Thank you.
Thank you, Vaidiki. This is Dr. Vidya Patil, Professor and Head from SDA Medical College, Dharwad. I thank facilitator Dr. Sucheta Madam and all the mentors and the organizers for this, providing us this wonderful platform. I'll go ahead with the integration topic with immunity, wherein we have tried to put in nutshell the alignment and integration of all the teaching learning sessions planned. So here it looks like this, the timetable we have tried to prepare, because the immunity topic, most of the things we are sharing with physiology. So we thought how to share different teaching learning methods and keep up our teaching hours as well. So here if you see in the timetable, initially few lectures are taken by physiology where we have aligned, and we will be engaging only the immunoglobulin part of it. Whereas they are taking on immune response classification, humoral, cell-mediated immunity and all. Then we will be taking a planning a flipped classroom on adaptive and innate immunity. So these are the two large group sessions. At the same time, we can have small group sessions, which can be in the form of case-based learning sessions on multiple myeloma. Here we have tried to club it with our own biochemistry competencies and objectives from other sessions, that is with the electrophoresis demonstration. Further, we have tried to plan an integrated teaching session wherein we can bring out the concepts of all antigens and the recognition with the linker case, followed by self-directed learning sessions wherein we have taken out few of the topics which are not covered in the earlier classes. Finally, one ECE session on vaccine development. And because most of the sessions are shared with physiology, we would like to take a revision in the form of tutorials followed by an integrated assessment. By planning this way, if you can see down, biochemistry total 7 hours, wherein interactive lectures, that is large group teaching, remains only 2 hours. And the SDL session for 2 hours, whereas others are all small group sessions and ECE. So we can divide our teaching sessions across different teaching learning modalities. Thank you.
I request Vandana to present. Dr. Vandana? Yes, Dr. Vandana?
Just a moment.
Vandana, are you there?
Hello.
Yes.
Yeah.
Good evening, one and all. I'll be discussing about the case-based learning session today related to the immunity topic. This has been prepared by Dr. Vediki and myself. Here we've included competency BI 10.3 and BI 11.16, that is regarding techniques. And it is a case-based discussion on multiple myeloma, followed by a demonstration on serum protein electrophoresis. This would be done during a practical demonstration class of 2 hours. The specific learning objectives for this session are: at the end of session, the phase 1 learners should be able to enumerate causes of hyper and hypogammaglobulinemias, enlist the common investigations for multiple myeloma, describe the rationale, procedure, and interpretation of urine test for Bence-Jones proteins, observe the steps of agarose gel serum protein electrophoresis, identify various components of serum protein electrophoresis pattern, discuss the types and applications of electrophoresis, identify the pattern of serum protein electrophoresis in multiple myeloma or monoclonal gammopathy, substantiate the probable diagnosis of multiple myeloma from clinical features and laboratory results, and identify the importance of urine and serum tests in diagnosis. Now in the CBL module, there is pre-preparation in the form of briefing the facilitators, and the actual session has been planned. In the pre-preparation, facilitators were briefed to assist the learners through the facts and engage them in guided discussion to achieve learning objectives. And during the session, after the case has been established with the demonstration of serum protein electrophoresis and urine Bence-Jones proteins, the practical classroom setup was divided into smaller subgroups, and then the students were asked to analyze the case in groups, followed by brainstorming. Learning objectives were achieved, and then there was dissemination of newer findings, if any. Then the group shares their results and identify any areas of improvement. At the end of the session, the student response was taken in the form of feedback and reflective writing, along with the facilitator's response as feedback. In the form of a vignette, the case was given as a 68-year-old man presented with complaints of weakness, easy fatigability, lower backache, and anemia for 1 month. The laboratory investigations were also given to help the learner to deduce a diagnosis. The X-ray of skull of multiple myeloma patient showing osteolytic punched out lesions were also shown. This was followed by the demonstration of serum protein electrophoresis and a demonstration of urine Bence-Jones protein as heat and cooling test. The electrophoresis patterns were given to them as potters for discussion, where they could appreciate the differences between pattern of a normal person of that of a hepatic cirrhosis, immediate response pattern as in infections, and the M band or the M spike in case of multiple myeloma patient. The questions for discussion were: enlist the different types of electrophoresis, explain the principle of serum protein electrophoresis, summarize the procedure of electrophoresis, compare the components of normal serum protein electrophoresis pattern with that of a multiple myeloma case, interpret a given electrophoretogram, enlist applications of electrophoresis, execute other relevant investigations for multiple myeloma. Here, the continuous assessment was done by the facilitators in the form of active participation and preparedness of learners. Besides this, the assessment was also or can also be made in the form of short answer questions, multiple choice questions, viva voce, charts or spotters, and a quiz. Now, the IMG roles state that the Indian medical graduate should be a leader, a communicator, and a lifelong learner. And the CBL tests all these roles of a IMG. And apart from this, it also helps them to develop collaborative team-based approach towards learning. also develops critical thinking through analysis and reflection, and it also confers self-evaluation. Thank you. And now I hand over to Dr. Vijeta, ma'am.
Thank you, Dr. Vandana. I am Dr. Vijeta from KMC Manipal. I'll be discussing integrated teaching session for BI 10.4 and BI 10.5. The department involved in this integrated teaching are biochemistry, physiology, microbiology, hematology, and nephrology. The specific learning objectives for integrated teaching are define immunity and immune responses, discuss major histocompatibility antigens, self-recognition, autoimmunity, and graft versus host response, define allograft, autograft, and xenograft, define transplant rejection, list the causes for transplant rejection, explain the role of cytokines in transplant rejection, list the biochemical investigations in the progression of transplant rejection, immunological basis for severe combined immunodeficiency and acquired immunodeficiency syndrome. Initial 10 minutes will be spent to explain about the integrated teaching. 15 minutes are given to 3 departments, that is biochemistry, physiology, and microbiology, to cover their specific learning objectives. Another 30 minutes will be spent by nephrologist, who will explain a case on transplant rejection of kidney. And finally, 15 minutes to a hematologist to explain the immunological basis for severe combined immunodeficiency and acquired immunodeficiency syndrome. After this series of lectures, 10 minutes break will be given to the students, and then they will be involved in the multiple group activities. So for the group activities, the allotted time is 40 minutes. There will be various type of group activities, such as match the following words and picture display and writing the reflection. Finally, 20 minutes feedback by the faculty, and to motivate students, a best interactive team will be given a reward. Finally, summary and conclusion, 10 minutes. So linker case for transplant rejection is as follows. The patient history is given, then following investigation. This patient is diagnosed as a IgA nephropathy who needs a transplantation, and after the transplantation, patient develops the symptoms, which is acute graft transplant rejection. After this linker case explanation by a nephrologist, hematologist will explain the immunological basis, and then students are called for the different activities. These are some of the sample examples for activities. Match the following. Next slide, ma'am. Crossword activities. And picture will be displayed, and the students are asked to write a reflection. The figure 1 shows transplant rejection and figure 2 shows graft versus host reaction. So coming to ECE session, this is prepared by myself and Dr. Vineet. The topic for ECE session is vaccine development. SLO for ECE are: at the end of ECE module, first MBBS student shall be able to describe the concept involved in development of vaccine, that is preclinical and clinical stages of vaccine development, enumerate different types of vaccines with examples, explain the biochemical mechanisms of active immunity through vaccination. The plan for ECE as follows. In the department setting, initial 30 to 45 minutes spent by the biochemistry faculty to show he will show a video on different stages of vaccine development, and then list the basic requirements for any vaccines, discuss active immunity induced by vaccination and different types of vaccines with examples, list the newer vaccines implemented during the 20th century by ICMR in universal immunization program. After this initial discussion in the department setting, students will be allowed to go to childhood immunization clinic, where they will spend another 45 minutes. There, we expect them to explain the importance of childhood immunization in prevention of infectious diseases, describe the disposal of material following vaccination, identify the vaccine vials, including their storage requirements, explain the basis of potential reactions or complications, and treatment of minor side effects post vaccination. After their exposure in the clinical setting, students will go back to their respective department. The 10 minutes will be spent by a biochemistry faculty to summarize, 20 minutes given to the student to write a reflective writing, and students are divided into two groups for the debate, and the topic will be given to them is who will win the COVID-19 vaccine production race, pros and cons. After this debate, assignment will be given to them and 1 week time is given to submit. Two topics are given for the assignment. First one is need for vaccine development for COVID-19 and identify the phases of clinical trials for COVID-19 vaccine development by different companies in countries like India, UK and Russia. Now I hand over to Dr. Vidya ma'am. Thank you.
Yes, Dr. Vidya.
Hello.
Dr. Vidya.
Hello. Am I audible, sir?
Yes, yes, Vidya, you can go ahead.
Yeah. Now I'll be presenting on self-directed learning for the learning objectives for BI 10.4. A few topics we have picked from there to list the cytokines with their source, target, and functions with control, which control immune responses, and to distinguish between types of hypersensitivity reactions with examples. So total duration is 2 hours. We can divide it into 2 different sessions of 1 hour each. So this SDL we would like to plan based on a jigsaw type of an activity where 100 students will be divided into 4 expert groups of 25 each. Students will be performing each activity as specified for that group. Students need to plan the activity based on the learning objectives which are given. They can approach the group facilitator for guidance on task and the resources as required during first session and also even after that. Students need to submit the activity in 1 week as a soft copy, which will be shared with all the students. Now the students will be forming study groups by mixing the students from all expert groups and will go through all the soft copies which are given to them. So these study groups roll numbers will be given to the students. Then the students need to specify the contribution of each participant in case if it is a group activity. For example, expert group 1, the task given is to prepare a poster on cytokines. It is a group activity of 5 students, and the motivation is provided by putting it like a best poster will be printed and displayed in the department museum. Task 2 is to prepare an e-learning module on hypersensitivity reaction, and again group activity of 5 students. Best module will be shared with students as a learning module. Group 3, we have a task to solve the problem given by identifying the objectives and explore the possible explanations and prepare a presentation. That's also a group activity. Best case resolution will be selected to be presented in weekly scientific meet of our college. Task 4, create one SEQ case-based, one SAQ application-based, and one MCQ type of your choice on immunity topic with references and key answers. That's an individual activity. So here we motivate them by telling ideal questions will be included in our departmental question bank. So post SDL activities in the second session after 1 week. Here again we give 20 minutes for the study group discussion. One selected activity per each task will be presented with 5 minutes each. Then students will be writing reflections on their learning experience. Here we motivate the students. That is, interested students are given an opportunity to share newer activities which motivate their learning. Students will also be encouraged to do self-assessment on their learning to identify their strengths and weaknesses. Students' reflections will be assessed and appropriate feedback will be given on the process of their learning. Learning content, however, will be assessed as a part of class tests. Next slide, ma'am. Yeah. How to assess is very important here when it comes to self-directed learning sessions. Most of the times we feel it is subjective, but still it carries equal importance and we cannot neglect it. We can try to bring in some objectivity by using some rubrics for assessment by the facilitators. One example we have tried to create to assess this thing, wherein we have tried to create a rubric telling what is ideally expected from the students and what behavior from the students needs to be directed and what type of students need to be motivated. I'll just read out one example, the first one, in which the ideal response from the student is if he participates in the task with completeness and quality. In case a student participates in the task without completeness and quality, he needs to be directed. He is participating but without completeness and quality. In case other student does not participate in the task at all, then he needs to be motivated. So here, what is ideally expected from the student? It is mainly related to his motivation level, his self-directed learning attitude. So here, by creating such rubrics for different STL activities, we can try to assess the STL attitude, professionalism, and the lifelong learning behavior of the student. And we can document the learner's progression to achieve milestones, to become a lifelong learner when he does it every time. That is, by doing such assessment, it tells whether the student does it or no, and not merely he is just able to do it. So these milestones can act as descriptors of EPA, what we call as entrustable professional activity, when the learners ascend the ladder from novice to becoming an expert. So that is how we can think of framing such rubrics so that it helps each student what is ideal and where even facilitators can know where they need to direct or where whom we need to motivate. Next slide. So finally, we come to the last part of our presentation on tutorials and integrated assessment. As I told you, because this immunity topic is broadly shared between physiology and biochemistry, students should not get confused like what to read in biochemistry or physiology. So we would go with the final tutorials on with the revision. So that is by snowballing technique. First 10 minutes we'll give the instructions to the students. We are going to give them the topics to come prepared because this is a revision class. So first, students will go through the contents of whatever we have specified individually for 10 minutes. Specific topics will be given to each roll number. So for 10 minutes, they'll go they go through the contents individually. Then they get paired and discuss for 10 minutes. Then 2 pairs join together to form a group of 4 and discuss. Then now suddenly we jump on to 5 groups of 4 to make a group of 20, which is going to discuss on a particular single learning point. That is 40 minutes of snowballing is going to happen. So I think I'll explain with the next slide, madam. Yeah, if you can see here, we have given the topics, 5 different topics for 20 different students, group of students. So each group of students will be going on through each particular topic by a snowballing technique. When they become 20 students, all the subgroups are going to join to form a whole. So each group will have gone through one of the particular topic. So now from each group of 20 students, one representative will be selected so that we'll be covering all the 5 topics told to them and they will be explaining the concepts learned in brief. And finally, we conclude the tutorial session with a summary and conclusion. Now the integrated assessment, which can be done as a written class test of 1 hour following tutorials by SAQs, MCQs, or case-based reasoning questions. At the same time, equal importance to be laid on the continuous assessment in CBL session by assessing active participation and preparedness by direct observation. Continuous assessment in EC sessions by assessing active participation by direct observation, reflections, learning content evaluation by test or assignment. And finally, assignments or participation in an STL session. So that concludes our presentation. I wholeheartedly thank Sucheta ma'am, our facilitator, and all my teammates for making it happen. Thank you, ma'am. I hand over to Sucheta ma'am to summarize the session.
Thank you, team. And thank you, everyone, for this excellent teamwork that is there. The webinar is now open for discussion. This has been a very good journey. I'm also, simultaneously reading what we are seeing in the CBME. Dr. Nibriti is also, giving her suggestions. So we should have a look at them. Also, she says that define and differentiate the terms immunodeficiency, tolerance, and unresponsiveness. Concept of super antigen, T-dependent and T-independent antigens, I think we've mentioned. And link the cytokines is too free-ended, and every day a new cytokine is coming up. Okay, list the cytokines. And then marker cytokines for different cells, regulatory and inflammatory, may be a better choice. Okay, for list the cytokines, that SLO. Anything else that anyone wants to suggest? Please put your hands up. Dr. Bedi will unmute you. Dr. Amrita says that the SDL tutorial snowball technique is very helpful to know and implement. Thank you, Dr. Amrita.
I don't see any hands so far.
Can I come in, Dr. Sanjay?
Yes, please.
Hi, Dr.
Hi.
Sujit. I particularly liked the first slide that you wrote about the group dynamics. It's so true. I was just wondering, maybe there was need for us, I mean, looking back and reflecting, that maybe there was need for us to also do this group dynamics thing in the beginning when we just started this whole exercise. And also to have told people ki, you should come online and you should be present online, not turn off your video or anything. In the sense, there would be more social interactions and the group formation probably would work, the dynamics would work better. But I think this is an excellent lesson that we have learned, that group dynamics is something that needs to be taught, and over time it does heal and get better, but it is something that we need to talk about and be aware of. That's one point.
True.
Secondly, congratulations, lovely presentation by the group, and two such diverse topics, and put together very nicely. I like the immunity part very, very much. Congratulations to Vijeta and Vaidiki. They really did a great job there. Of course, congratulations to everyone else also in the group who have done a lot of work. Immunity is an extremely challenging thing, and I think it is much, much more difficult and more biochemical than anything else. And in pathology, the entire inflammation and immunity chapter is actually biochemistry. So we really should look at integrating that part there, both for inflammation as well as immunity. Anyway, very, very well done. Thank you.
Thank you so much. Thank you. All the hard work of all these girls. And of course, the Krishna. Anything else anyone wants to say? Thank you, Pradnya, for those words. So it's closing to 8:30. Should we say, should we stop here?
Yes, I don't see any
All
raised
right.
hands.
Okay, okay. Thank you. Thank you so much for listening, everyone. And have a good night. And let's meet you again on Friday. One
Thank
thing
you,
before
Bedi.
we close, just one small thought entered my mind. One session we will have regarding the skills, the 11. I have just left it open, thinking that we can just have each one sort of tell us what they are doing in their institutions. So is that fine if we keep it open? Put it in the CBME group what your view is about how we tackle that competency 11. All right.
Yes, ma'am.
You need not give us an answer immediately, but do let us know how you want to do it, go about it. All right, because we've not
Yes,
given
ma'am.
any onus on anyone.
Yes, ma'am. We
So
will do
with
that.
that, thank you so much. Yeah. Good night.
Thank you, Bedi sir, Sucheta ma'am, and Pragna ma'am, and my team members for the wonderful presentation. Thank you, one and all. Good night.
Good night.
Thank you, ma'am. Thank you all.